Breathe out. Breathe out. And the patient can actually like that. It feels pretty good when we do that. Head, just like that. Breathe out. Hello everyone, this is Dr. Jeff Eccles again, and today we're very fortunate to have Miss Erica with us here. And Miss Erica's got an interesting history. She was involved in an automobile accident quite a while back in 2008, I believe. Is that correct? Mm-hmm. And she really did some damage to her spine and part of her ribs, and we've just finished examining her, and we found damage to the upper part of her back, to the rib areas, which really gives her a lot of chronic pain. This bothers her a lot, probably more than any other problem. And also during the examination, we found problems in her neck. And she's really not having a lot of neck problems, but as soon as I touched those areas, she was wincing, and it was really not very comfortable to her. So we definitely want to address those as well. Now, she hasn't been to the chiropractor in probably over a year. And I've already kind of cautioned her that when we first start, she may get a little bit sore, which is kind of normal. And sometimes the doctor, you know, they all want to help people, but sometimes they get busy and they don't really explain to the person that, you know, after your first adjustment, you might get a little bit sore, just like going to the gym and working out. And I've even had patients who came to me after seeing another doctor that did not explain that to them, and they go, you know, I went to the doctor and the next day I was really sore and I actually felt worse than I did before I came in, so I never went back. That's a very common thing that happens with treatment, and I think if the doctor would have remembered to explain that to them, they probably would have still had that patient, and the patient might have gone, you know, Doctor so-and-so said that I probably would get sore, and sure enough, he was right, I did. So that has already been explained to Miss Erica, and she knows that and knows what to do in case she does get a little bit sore. So we're going to just give her a little bit of a light adjustment today. We don't want to do anything too drastic with her today because we do want her to have a real pleasant experience and feel better after her adjustment and not worse. So are you ready to get started?
Yes, sir.
Okay. So one of the first things I'm doing here is I'm just kind of checking her pelvis, and I can see that her right hip is really rocked back considerably, and that causes this right leg to be short. So this can cause a lot of imbalance in the pelvis, which can go on to cause problems all the way up into the spine. So we're just going to do some light stretching throughout the pelvis here. Erica, is that okay? No real pain there? That's fine, good. Oftentimes, just taking a little bit of the pressure as I push like this, we're separating the joints and stretching the muscles all at the same time. And the patient can actually like that. It feels pretty good when we do that, oftentimes. And on this one, we're kind of pulling the pelvic bones one way, pushing the spine the other way to give that nice rotation through there and stretching those muscles out. And we always tailor this to the person's comfort level. And I've already talked with Erica about this, so if she knows that if she has any discomfort that's more than just very minor, she can let me know so that we don't continue with that particular activity and we work within her comfort zone. Now, I'm going to use what we call the flexion distraction portion of this table to just gently give a little bit of traction through this lower back. Erica, can you feel that stretching in through there? Good. Now, she reports to me that feels good, which gives me the green light just to keep gently working through there. Oftentimes when a person has a severe lower back pain, this is a wonderful therapy to help really reduce that disc herniation in there, loosen up those joints, and help that person recover. I think that we've actually kept a lot of people off the surgery table with just this gentle technique right here. Great for herniated discs, joint problems in the lower back. And now we're just going to put a little gentle pressure through here. Breathe out as I push. Breathe out. Good. Breathe out. Breathe out. Breathe out. Perfect. Now that last one, we got some good movement through there. And that is actually the very spot where she really needed to have those moved in there. And we're going to also adjust her pelvis today. So, Miss Erica, what I want you to do is lay on this side for me, facing me. Atta girl. We're going to support your head like this. Now I'm going to bring this leg up like this. There we go. And you're going to get to give yourself a big hug. Are you okay there?
Yes.
Good. Now I'm going to just kind of pull this over and put a little pressure in through here. Breathe out. Just like that. I bet that felt pretty good, didn't it?
Yeah.
All right. Let's have you roll over on your other side for me. All right. Now we're going to just get you positioned correctly. This one goes like this.
Oh.
That was close. That was close. Breathe out for me. There we go. Big stretch. Good. Just like that. Very well done. Now she's laughing, so that's a good sign. Lay here on your back for me. And when I examined Erica earlier, I noticed she had a lot of tenderness along the right side of her neck, especially right up in here, right there, isn't it?
Yes.
That's the spot. So if you go to someone's neck, or if when you're feeling of the neck and it's really tender there, that normally indicates that there's some sort of inflammatory process or inflammation going on there in the neck. Well, why is it inflamed? Well, as long as there's no tumor there, which there usually is not, then the vertebrae are out of place and they're swelling there and they're causing some inflammation in that area. So by gently moving the vertebra into the right place and getting the normal function restored, it reduces that inflammation and the person starts to feel much better very quickly. So you'll hear a little click here as I just turn your head, just like that. Perfect. Now, was that okay? You're still smiling, so I guess that was fine.
It always kind of startles me.
Yeah, it is. Turn this way and just a gentle little movement right there. Perfect. Don't try this at home. You know, I've been doing this a very long time, and I've had extensive training on this, as has all chiropractors. So it's very important not to do this at home. It's actually intrinsically safe, but we don't want to have anybody made worse by your attempts to do this. All right. So we're going to do one more little adjustment with Erica today. She had some areas in her upper back that were really bothering her. Matter of fact, this was probably the thing that was bothering her worse than anything. And some of these vertebrae have actually shifted forward and causing a lot of tenderness through there. So we're going to do a little adjustment to help her with that. And Erica, I'm going to have you lean forward there, round your shoulders.
Just touching.
That's good. Tilt your head down. There we go, right there. Hope we can get this. Now, I'm going to have you put your hands right here like this. Tuck your head down. Good. I'm going to bring you all the way back. Breathe out for me.
With my chin tucked?
Yeah.
Oh, okay.
Oh, there we go. Very good. Perfect. You doing all right there? She's laughing
That
again.
one hurt a little bit.
Your arm there.
It's good.
Okay. Put your head back down again. Yeah. Cross your arms again. One more time. Okay. Breathe out. Easy does it. There we go. All right. Come on. Feel how stiff those are in there. Those aren't really moving that great yet, but they can. If this is troubling you later, I want you to just ice that down and then just do some stretches and that kind of thing and see if we can't get you some help.
Okay.
So I certainly hope that we've made you feel a
really
little
good.
bit
I miss
better.
having that done
Yeah.
a lot.
Yeah. Very good. thanks to Erica for being such a courageous model here for us today. And I certainly hope this helps bring her some relief. For more information on how you can get relief or help others, go to my website. It's www.jeffeccles.com. And I'll see you on our next video.
Please subscribe to our channel. And you should also visit our new website. Because we have over 1,300 videos on our channel, I know it can be a little difficult to navigate and find the videos that you want to see. But if you visit us at psychetruth.net, you'll be able to find the videos you want to see and watch them there. So we encourage you to go to Psyche Truth next time you want to search for something, and we look forward to seeing you again soon.